Hi, I'm Heather Kinder, the Executive Vice President for the Founders Affiliate of the American Heart Association. We represent the 8 states of the Northeast, New Jersey through Maine. Welcome to the first Impact Call. These calls are here to talk to you about what you've made possible through your work as a volunteer, through your donations, and we're here today to talk about high blood pressure guidelines with Dr. Suzanne Steinbaum. Welcome, Dr. Steinbaum.
Thank you.
Dr. Steinbaum is soon to be the Director of Women's Cardiovascular Prevention, Health, and Wellness at Mount Sinai in New York City. She's also completed her training in both preventive cardiology as well as cardiology, been a fellow of the American College of Cardiology and the American Heart Association, as well as a local national volunteer for the American Heart Association through your work with Go Red for Women as a national spokesperson. You're a member of our New York City local board of directors. You should be on salary with us at the Heart Association.
I love the American Heart Association.
That comes clear. Well, welcome. Thank you so much for joining us today.
Thank you.
And today we're talking about high blood pressure and the new guidelines related to blood pressure.
As a preventive cardiologist, this guideline is really something that excites me. We know that the risk of heart disease and stroke doubles at a blood pressure of 130/80. And that was considered pre-hypertension at one point, and now we're saying that is stage 1. And what this provides us with is a tool to say we have to take action. These guidelines are really about action steps and targeting people sooner in their development of high blood pressure to take steps and make interventions to really prevent the blood pressure from getting worse. Many people were concerned that looking at a blood pressure of 130/80 as being hypertensive would actually increase the number of people on medications. And although that might be true, because we are certainly increasing the number of people diagnosed with hypertension from about 32% to 46%, what we're really saying is understand what your risk is. And if you have a blood pressure of 130/80, don't be so complacent. Really do something. And this is when lifestyle intervention becomes important. Diet and exercise, watching your weight, keeping your sugars down, not smoking. All of these things become more important earlier on. And this is where early prevention becomes critical because we know the huge impact of high blood pressure on heart disease and stroke.
Now, as a practicing cardiologist, you see patients all day long. Are you seeing any kind of impact in terms of when you say take preventative action, are they listening now that the guidelines are changed? Are they taking more action, do you think?
I think what's interesting is these guidelines really became known by many people very quickly. The information got out there enough that patients come in with articles. And when they come in with articles, for me, that's a great window. So I love being able to say, let's look at that together. And let's look at how important blood pressure is on overall health. I love that I can say 130/80 doubles your risk of heart attack and stroke. So let's get it lower than that, and let's put those lifestyle steps into play. And they're ready. They're ready to hear it because of these guidelines, I believe.
That's very inspiring to hear. That is our greatest goal, is to have impact on people's lives, and really before they have illness, before they become sick. So this preventative focus, I think, is really important.
You know, Heather, that's been my passion, to really prevent heart disease and stroke, to really help people take control over their lives and empower them with this information. And I think what this does is give us a tool to say to people, here's the importance of prevention, and you can do this. And we know 80% of the time, heart disease is preventable, and now we can really say, let's jump on the blood pressure issue earlier, and we can really have an impact on the outcome of your health.
You know, this is, I think, providing guidelines like the high blood pressure guidelines is a real value that the Heart Association offers the community. And can you tell us, talk a little bit about how the Heart Association arrived at the change in these guidelines?
So in 2013, the National Institute of Health went to the American Heart Association and said, it's time. It's really time that we work on these blood pressure guidelines. And the American Heart Association, along with the American College of Cardiology and 9 other governing bodies, went through over 900 journals, scientific studies. There were 21 people reviewing these studies, and basically it took 3 to 4 years to get it published. And what was seen through all of these trials was really how important it is that blood pressure is low. And that's why these guidelines were changed, to really give people the understanding that high blood pressure is so bad for you. And ultimately that jumping on it earlier and really preventing it is so critical.
You know, this is going to be broadcast to all of our millions of supporters and volunteers across the affiliate. And I think it's really important that we all understand the role of the Heart Association. And I think we're uniquely positioned to bring all of those agencies together to be the collaborator, the convener, and creating this new recommendation, new science. And so it's really important, I think, that we all appreciate and be able to articulate that because it affects people all around the world, really, and your neighbor, your sister, hopefully they'll be healthy and strong. But if they need to have this recommendation for their doctors, the science is there, and that's because of the Heart Association and volunteers like yourself.
One of the things that I think becomes so important for everyone to understand, heart disease is the #1 killer. End of story, across the world. And when we look at it, 80% of the time it's preventable. Now, if we don't look at the Heart Association as the messenger of this particular message, that this is something we need to do as people, as a population, as a family, a friend, a mother, a sister, a husband, a brother, an uncle, let's go through this. That this is about our lives, and this is about how we choose to live our lives. I look at a guideline like this as being empowering, informative. It's putting a lot of information into people's hands, and that's where it has to sit, because people need to understand this is about them taking charge of their lives. I never looked at this as a pusher of medication. This isn't about medication. We know when medication is necessary. If you've had high blood pressure, if you've had a heart attack, a stroke, if you have diabetes, if you have a strong family history, or your 10-year risk is really high, you need medication, and we know that. But what these guidelines are really telling us is that people need to really pay attention to how they live and the choices that they make.
Mm-hmm. And really, I think appreciating how diet, exercise, the choices you make in your life have an impact, and you have a lot of power over your health should you choose to. And I think this inspires physicians to have that conversation with patients. Patients, I love the story of bringing articles to you. It's a conversation starter for sure.
Absolutely.
So a lot of the people listening to this are members of our board of directors or different committees. So for the layperson, for the non-physician, for the non-healthcare provider, you talk about this all day long. You're obviously years and years of training. What about the layperson like myself who doesn't have training? How would I go out into the community and talk about the value of high blood pressure guidelines like this?
I think the word guideline gets scary. So I wouldn't use that word. I would go out and talk about the importance of high blood pressure and really how much we know that even a slight increase in blood pressure causes a huge increase in the risk of heart attack and stroke. That it doesn't take a lot of high blood pressure over a long time, that it's really just mild increases in blood pressure can really lead to heart disease and stroke. And so getting your blood pressure checked and knowing if it's at 130 or over 80 or above, your risk goes up. And when someone gets that number of 130 over 80 and are told it's not that bad, that's not really the message. The message is it's time to do something. I think the other piece that's important to understand is really having people check their blood pressure. That there are kiosks and there are pharmacies and there are blood pressures kits that you can buy at home and have your own cuff at home, and really be proactive about going to these places or doing it at home. There are those people that come into the office. And I could wear a red coat, and they still have what we call white coat syndrome, which is really going into the doctor's office and having high blood pressure. And that is really just a phenomenon of being afraid and scared. And so we tell people, get it checked at home. Go to a pharmacy, go to a kiosk, go someplace where you can get your blood pressure checked, that you feel calm and relaxed. And that blood pressure is not a diagnosis once, it's a diagnosis over a period of time, several checks, but that once you know that your blood pressure is slightly elevated, do something. Just do something.
I think that's a great way to end this talk. Take action. Just
Take
do
action.
something.
Empower
Just do
yourself.
It.
Just do it.
Well, Dr. Steinbaum, thank you so much for being here.
Thank you.
Thank you all for listening. I hope you enjoyed the session. Hope it was valuable. Thanks so much for all the work that you do to make these mission moments possible. Have a great day.